High blood pressure is one of those rare conditions that can affect every part of your body, including your eyes, your brain, your kidneys, and your heart. Most patients feel completely well and free of symptoms until something goes wrong, and that's why we need to talk about it. I'm Dr Joban Sehmi. I'm a consultant cardiologist and a specialist in advanced cardiac imaging. Today, I want to talk about a condition that affects millions of people, often without them realizing it. It's high blood pressure. And the reason I want to talk about high blood pressure today is that it's extremely manageable, potentially reversible when caught early. If ignored, it can have a significant and detrimental effect on your heart health. High blood pressure is a really important risk factor for heart disease. But the difficult thing about high blood pressure is you can have it and be completely unaware that it's causing any problems. So blood pressure can be really high, and often it's not associated with any symptoms, can be associated with really vague symptoms such as blurry vision, a bit of tiredness, fatigue, very subtle palpitations. These are symptoms that most people would ignore, but there may be a very significant problem underlying. And with very good reason, blood pressure is known as a silent killer, because if it's elevated and it remains elevated for many years, it can have a detrimental effect on every single organ system in your body, including your heart. Blood pressure is not a disease exclusively of old age. It can occur at younger ages, and often at younger ages it's important to look for reversible causes. Because blood pressure doesn't produce any symptoms, it's often ignored. So it's really important that you attend routine assessments so that this can be measured and assessed by a trained healthcare professional. Detecting high blood pressure early is really, really important, because often all that is required to treat it are simple lifestyle modifications, and no medication may ever be required. The reason why blood pressure is bad for the heart is, if you think of your heart as a pump, and the blood pressure is the resistance against which the heart is pumping. And if the resistance against which the pump increases, then this causes the heart to become more inefficient and can predispose to the heart failing. High blood pressure is rightfully known as a silent killer because it can be elevated for several years and patients are often oblivious to this fact. But internally, it's having a detrimental effect on every single system within the body. The worrying thing about blood pressure is the first we ever know about it is when all the damage is done. In most people who have bog standard high blood pressure, this is often driven by lifestyle factors. High blood pressure at a young age, in the 30s and 40s, is a different matter. But for vast majority of patients, high blood pressure is driven by things such as your diet, a sedentary lifestyle, being overweight, and making poor lifestyle choices such as smoking and alcohol excess. With respect to diet, people who eat energy-dense foods, ultra-processed foods, and avoid vegetables, lean meat, fish, predisposing themselves to high blood pressure. Exercise plays a critical role in blood pressure, and you don't have to lose weight to benefit from the effects of blood pressure lowering. Any exercise, as a bare minimum, brisk walking, 30 minutes a day, will have a positive effect on your blood pressure and may also mean that you can avoid medication. There is a misconception that blood pressure is an age-related condition. Prevalence of high blood pressure increases with older age. Again, there's another misconception that women are protected from heart disease, are protected from high blood pressure. And to some extent that is true in very young women, but once the women approach the menopause or go through the menopause, then we know that they're equally predisposed to higher blood pressure. There is a specific cohort of patients who present with blood pressure at very young age, in their 30s and 40s. And in this particular group of patients, it's really important to look at an underlying reason, and this is really important because often this is reversible. Important reasons include structural changes within the heart or the blood vessels leaving the heart. There can often be an issue with the blood supply to the kidneys. A common reason for high blood pressure in really young individuals are tumours, and this is not cancer, but these are growths within the adrenal glands. The adrenal glands produce a lot of hormones, including adrenaline. And if there are growths within these glands, these can stop them from working effectively, essentially going to overdrive, and this can also manifest with elevated blood pressure. I'm going to talk a bit about blood pressure and what the numbers mean. So when one records a blood pressure, you're often given two values. The first value, when your blood pressure is measured, you will be given two numbers. For example, a normal blood pressure is 120/80. The first number, 120, refers to the systolic blood pressure. So that's when your heart is working and contracting and pumping blood out of the heart. So it's higher than the second number. The diastolic number, in this case 80, refers to when the heart is relaxing. And both these numbers are important in trying to diagnose high blood pressure when the readings are consistently above 140/90 millimeters of mercury. It's very important that you have multiple readings over the course of a day or longer to truly understand if your blood pressure is abnormally elevated. So often when patients come to see me in my clinic, they're very anxious, they're very stressed because they are concerned about their heart health. And when I measure their blood pressure, it's often very sky high. And the fact that they're in a clinical environment, that can confound the readings I'm getting, and I don't rely on this blood pressure or make a single diagnosis based on just one or two readings. It's very important to understand what the blood pressure does in your own environment and having multiple measurements so that I can come to an accurate and clear diagnosis. Blood pressure is important to recognize because there's a lot that you can do about it before it becomes a really serious problem. And it's really important that a patient makes healthy lifestyle choices so that they can mitigate against the risk of high blood pressure. Following a good diet, really important. A Mediterranean style diet is probably the most beneficial. We know that people who live in the south of France, for example, whose diets are rich in fresh vegetables, fresh fruit, lean meat, fish, they routinely live longer, lower blood pressures. And another important factor is avoiding ultra-processed foods. These contain lots of nasty chemicals that we know have an adverse effect on blood pressure. In terms of when to eat, a useful intervention is intermittent fasting, which means restricting your feeding window to 8 hours a day. So eat normally within those 8 hours. For the remainder of the time, which is 16 hours, water, black tea or coffee is advised. Vast majority of the fasting time happens while you're asleep. You only have to fast for a relatively short period of time. So I've seen dramatic weight loss, dramatic changes in blood pressure. Addressing your diet, addressing the way you eat can have an excellent effect on your overall health. Reducing the amount of salt in your diet has a beneficial effect on your blood pressure. There's a strong association between high levels of salt, particularly dietary salt, and increased blood pressure. It is recommended that the total amount of salt you're allowed within 24 hours that is safe is 2 grams, and that's the equivalent of 2 teaspoons of salt.